Hi, I'm Cory Hughes with Ried Physical Therapy. One question that I get a lot about different techniques that therapists use is about joint manipulation, which other terms tend to be things like adjustment or a pop. Are those techniques safe? And the answer is yes, those techniques are safe as long as they're performed by a professional, number one, who's trained in the technique. And number two, you don't have any underlying conditions that are going to put you at risk of being injured. Some things that kind of put you at risk are things like arterial insufficiency or any kind of nerve problems, unstable bones, so bones that are moving kind of a little squirrely and not really the correct kind of way. And a professional should be able to assess those things. So these are techniques that I use a lot, and to keep people safe, some of the things that I do are make sure that things are moving the way that they're supposed to, and make sure that different structures aren't being impinged upon and are going to be safe and clear while we're doing these techniques. With that clearance, these techniques are going to be things that help you out more than anything else. The big thing is making sure that the ligaments are stable and making sure that the arteriovascular structures, meaning arteries and veins and nerves, that kind of thing, those aren't going to be compromised during the technique. The big thing is these techniques are safe. They're techniques that I use. They're just not always the best option for everybody. A lot of times they can lead to long-term instability if performed inappropriately or performed too much. And a lot of times people lack the proper mobility at different sections in order to be able to tolerate these things. So the best way to know if one of these manipulative techniques is good for you or if you're going to be safe doing it is to ask your physical therapist. Let your physical therapist take a look at you, see what's going on, and make sure you're going to be safe with the technique beforehand. And you can always ask a therapist what's going on and if this is going to be the best option for you whenever you're discussing treatment choices.